While there are no true aphrodisiacs, we have some tips on foods that might improve your libido. And we bust a common myth about oral pleasure. That's next on Sex Talk.
Welcome to Sex Talk, where we answer the questions you've always wanted to ask about sex and relationships. I'm Dr. Leah Janine, Associate Professor in the Department of Health and Human Performance at Nova Southeastern University. And joining me today is Sex Talk correspondent Derek Latta.
Good to see you again, Dr. Leah, like always. You know, I love this show. I get stopped sometimes in the supermarket and people come up and say, hey, you're the guy in the Sex Talk. We love Dr. Leah. You guys do such a good service to the community because we answer questions that people are afraid to ask or they don't know who to ask. And so we've solved a lot of problems, probably hopefully saved a lot of marriages or things like that. But anyway, the first question we have is kind of timely because there's a lot of men with beards. So are we ready?
Okay.
Okay, here we go. Can oral sex really bleach my beard? Is there anything I can do to prevent it?
Well, this is a common misconception, but the truth is this is just a myth. While vaginal fluids can alter the color of your underwear, there isn't any science to back up claims that it can change the color of hair follicles. What is happening is that the pH of fluids causes the color change for those types of materials, like cotton, but it has no effect on hair.
So what would cause the color change in a beard?
Well, with someone with a brown or blonde beard hair, they may notice that the beard is getting more red, even if they don't have any other red hair. Keep in mind that the answer can be just as simple as a light change. Maybe it appears different in different lighting, or perhaps there is a reflection that makes it look like it's a different color. Genetics and environmental factors can actually change the color. Sun can cause the color to change, and so using sunscreen can help protect the color.
So there's really nothing to be worried about. It's
No.
not dangerous. It's not going to, okay.
Yeah, just a
All right,
myth.
no worries. Okay, next question, Dr. Leah. A lady asks, menopause has completely taken away my desire for sex. What can I do, Dr. Leah?
Unfortunately, menopause can significantly impact sexual desire, but there is a lot you can do to improve your libido and have a fulfilling sex life. Start by talking to your doctor. They will be best to help you navigate the changes that you are experiencing. There are several medications that might help. Menopausal hormone therapy, vaginal moisturizers, lubricants, or estrogen can help with vaginal dryness. Consistent use of vaginal moisturizer every 2 days and lubricants during intercourse can alleviate discomfort and make sex more enjoyable. A doctor might also monitor testosterone levels, which can naturally decrease with age.
So what is it about the menopause that causes these changes?
Well, during menopause, estrogen declines. Lower estrogen levels can reduce sexual desire and make arousal more challenging. With age, chronic illnesses, injuries, and changing body image due to aging can all affect sexual drive. Vaginal dryness causes problems because reduced natural lubrication and less stretchiness in the vaginal canal can make penetration painful. Diminished blood flow to the genitals can also reduce sensitivity and response during arousal.
So besides medication and lubrication, what else can we do?
Well, add some variety to your life. Experiment with different positions, times of day, or locations. Foreplay like sensual massages or oral sex can be stimulating. If you're open to it, incorporating sex toys and fantasies can also help enhance your experience. Also, prioritizing sleep can be helpful. You'll also want to manage anxiety that you're experiencing and communicate with your partner so that they can support you in the way that you need it. There was a recent study that found sufficient sleep can boost sexual interest. And when it comes to stress and sleep, be cautious of using alcohol. Many women might think that it is helping to find relief when it could be causing symptoms to be even worse. Having sex when you're not aroused can also lead to lack of lubrication. Alcohol intake can also be a problem. Take a listen to this.
When it comes to alcohol, moderation is key to good health, even more so for women trying to minimize symptoms of menopause, according to Mayo Clinic's Dr. Juliana Kling.
A lot of women have different triggers, and for some, alcohol may trigger their symptoms, and so they may just naturally avoid it because they notice that their hot flashes and night sweats get worse.
Sleep problems are another common symptom of menopause, and she says alcohol can make it even harder to get a good night's sleep.
Many people think, oh, a glass of wine might be nice to make me sleepy. It just disrupts your sleep.
Dr. Kling advises menopausal women to also consider the connection between alcohol and increasing health risks.
Alcohol is associated with a higher risk of breast cancer, also things like colorectal cancer.
On average, Dr. Kling recommends limiting alcohol intake to no more than 1 drink per day, and don't go by the size of the glass.
And not a big glass. You have to measure it out to make sure it's an appropriate portion of alcohol.
So, Dr. Leah, in general, it seems like alcohol does not help with sexual functioning.
You're right. It is negative to the central nervous system. It can cause depression because alcohol slows down brain function, breathing, and blood flow, which can reduce sexual stimulation. For men, this can make it difficult to get an erection and may also delay orgasm. For women, it may make it more difficult to orgasm or cause the orgasms to be less intense. Also, dehydration can be a problem with alcohol. It can increase levels of angiotensin, a substance that narrows blood vessels. This can also contribute to erectile dysfunction. It also affects hormone production. Alcohol can cause testosterone levels to drop in as little as 30 minutes after consumption, which may lower sex drive and lead to poor erections. Chronic heavy drinking can damage nerves and blood vessels and increase the risk of cardiovascular disease. This can also lead to decreased vaginal lubrication and dyspareunia in chronic alcohol users.
You think there's like a balance between maybe having like a glass of wine or maybe somebody doing a shot that's not too much? Would that maybe lessen the inhibitions perhaps?
So I did actually read a study that says that people are calmest with a blood alcohol level of 0.04, which is pretty small. For someone my size, that's going to be a glass of wine, and not the way I like to make glasses of wine. This is a 4-ounce glass of wine, not like a glass of wine. So the problem is really that people drink too much and then you get that bad anxiety the next day. And so really we just push past the calmness. So a very tiny amount of alcohol can reduce that stress and anxiety. Very few people end up stopping at 1.
Okay, that's good. Thank you, Dr. Lee. Our next question. We have a viewer who says, can eating meat improve my libido?
Certain foods could improve your sex life because they tend to improve blood flow. Meat contains certain compounds like L-arginine and carnitine that are good for this.
You know, I hear a lot about L-arginine and carnitine. Can you explain a little bit more about that? What's the difference?
Yeah, L-arginine is an amino acid that helps the body build protein. While the body typically produces enough L-arginine on its own, consuming more can have potential effects. This amino acid is known to boost nitric oxide levels, which improves blood flow. Carnitine is a compound that helps the body convert fat into energy, produced primarily in the liver and kidneys. Carnitine is stored in different tissues, including the skeletal muscles, heart, brain, and sperm. Similar to L-arginine, carnitine helps enhance blood flow, which is vital for maintaining an erection and overall sexual health.
You know, you mentioned meat. What are the other sources that are good?
Well, you'll mostly find carnitine in animal products, with red meat being the richest source. They say that the redder the meat, the higher the carnitine content. But it's also in dairy products, fish, and poultry. L-arginine is in foods like turkey, pork loin, chicken, pumpkin seeds, soybeans, peanuts, and spirulina.
You said spirulina?
Oh yeah, spirulina. It's the vegan source, which is a blue-green algae, which may have many health benefits, including sexual health. Spirulina also contains arginine, which helps with the production of nitric oxide, enhancing blood flow to the penile tissues. This improved circulation can also help lower blood pressure and cholesterol. Animal studies suggest that spirulina may support healthy testosterone levels, particularly in aging men. And some smaller studies indicate that spirulina can improve sperm count and motility, contributing to better fertility.
That's one potent algae, huh?
Yeah, it's
Wow.
great. There's even some studies that show a link to weight loss, but I wouldn't run with that.
Okay, that'll be for another show.
Yeah.
We'll research that, people. You ready for the next question? Yep. Okay, cool. A woman wants to know, is there a natural way to make my breasts bigger?
There isn't a quick, natural way to increase breast size. You might know that some prescription medications can cause an increase in breast size as a side effect. Some examples include hormone therapy, birth control pills, and SSRIs, which are antidepressants.
Is there anything else that, like natural supplements or anything like that?
Well, be cautious about using any breast enhancement supplements because they don't work. Many products on the market claim to naturally enhance breast size through supplements containing herbs and saw palmetto and wild yam. It's thought that these foods have phytoestrogens that mimic estrogen in the body that cause these results. Despite the claims, there's no scientific evidence to support the effectiveness of phytoestrogens in promoting breast growth.
Okay, so we'll eliminate natural supplements, natural things. So what other options are there? Is there anything else?
When natural ways aren't effective, there are always breast augmentation procedures like fat transfers or implants. These are surgeries, so you'll want to weigh the benefits and risks with a doctor.
Thank you, Dr. Leah. Our next question. Is it okay to use Vaseline as a lubricant?
Well, Vaseline might not be the best sexual lubricant, even if it's convenient. It's better used as a skin moisturizer and for skin protection. One big reason is that it isn't compatible with latex and polyurethane condoms. The petroleum jelly can cause tears leading to unintended pregnancies and increased risk of STIs. It can also trap bacteria leading to infections. One study found that women who used petroleum jelly inside their vaginas were over 2 times more likely to test positive for bacterial vaginosis compared to those who didn't use it. It's meant to last a long time, which means it stays in the body longer, creating an environment where bacteria can thrive. Plus, it's just messy and it stains.
Is there any alternatives to the Vaseline that you recommend?
Well, opt for lubricants that are water-based, silicone-based, or natural oil-based. The water-based ones are the most widely recommended because they're generally safe with different condoms and sex toys. They're easy to clean, but they may require multiple applications. Silicone-based is longer lasting and also safe with condoms, but it can be harder to wash off and it might not work well with some toys. Natural oils like coconut oil can also be an effective alternative.
And it tastes good too.
Yeah, probably the best tasting one, unless you get the flavored ones.
And you could cook with it too if you want.
Yeah, use it in the hair, you know?
Yeah, it's a antibacterial too, I heard.
Yeah, and you know,
it's beautiful.
Antifungal, so it's great all around.
Antifungal, good, okay, good. You learn a lot in this show. Our next question. We want to incorporate something different than our vibrators and other toys. What are some fun toys for couples, Dr. Leah?
Toys can be a fun way to spice things up, and they can be used by individuals or couples. There are a lot of different options if you're looking for something that you both can have fun with. For example, there are bondage systems with different straps that are easy to remove. This can also be a way to explore different power dynamics. A door swing might also be fun. It's temporary and easily removed.
You know, one of your shows before you mentioned different things like certain pillows, shapes of pillows that be able to access body parts better, or
the good old cheese wedge pillow.
The cheese wedge.
Yeah, the cheese wedge, that's what I call it. Looks like a great big cheese wedge. And then I recently found out that they have ones that are vibrating cheese wedges, which is not the technical name, but vibrating cheese wedge type pillows. So.
Okay, so the key perhaps is vibration, right? So
yeah,
would you recommend what kind of vibrators are there?
Why not? Oh gosh, there's a wide range, right? There are bullet vibrators and finger vibrators that are known to add some spice to the bedroom. They can be used by either partner, enhancing stimulation on the clitoris or even the tip of the penis. You can even buy kits that come with all sorts of toys to try. Some kits come with vibrators, stimulating sleeves, penis rings, or anal beads. Kits could be a great way to experiment with some new things and figure out what you like.
You know, I've seen those little vibrators. They're called body massage. They're selling them at CVS and Walgreens at this big $9.99. Just go there and that's it.
Yeah, nice and cheap. And I mean, nowadays you can get it all online, delivered to your house. And, you know, if you're willing to go into a sex store, they have testers. Not like that, not like that. Just you can touch a tester and see the different types of materials and how they vibrate. You don't get to like go into a private room with the tester.
Let's move on to the next question.
All right.
A viewer asks, I had an abnormal pap smear. What do I need to disclose to future partners?
If you have HPV, know that it's very common. According to the CDC, 4 out of 5 people will contract HPV at some point in their lives. Many people won't even be aware that they have it because it often doesn't cause any symptoms. It can spread through vaginal, anal, and oral sex. The good news is that most of the time the body will clear the infection on its own. And while HPV can cause genital warts, the strands that lead to abnormal pap smears are typically those that can cause cervical changes. Most of these changes do not progress to cancer. That being said, make sure you communicate some of this to your partner.
Dr. Leah, can you give us some more examples, please?
Well, let them know that HPV is very common and that it's typically harmless and it typically takes care of itself. And when it comes to a pap smear, let them know that cell changes do not mean that you have cancer, but that regular monitoring will still be important. Regular pap smears and HPV vaccinations can help reduce the risk of cervical cancer. There can be a lot of myths about HPV, so stick with the facts and just know that it is a common part of being sexually active. If you need more support, look into some trustworthy sources like the CDC or materials from your doctor. You can even encourage your partner to speak with their doctor for more information. Even if getting an abnormal pap smear is fine, it can be scary. One doctor tries to help explaining exactly what that means.
Hello, I'm Dr. Christina Butler, a gynecologic oncologist at Mayo Clinic, and I'm here to answer some of the important questions you might have about cervical cancer. Pap smear screenings begin at age 21 and continue varying by age every 3 to 5 years. Having an abnormal pap smear is very common, so don't feel alone. It just means that additional tests are needed to prove that cervical cancer isn't present. Most people with abnormal pap smear do not end up having a diagnosis of cervical cancer. Most recently, the HPV vaccination has been increased to include all adults, male and female, to age 45. Absolutely. After cervical precancer or even HPV exposure, the vaccine remains to provide benefit. We have good evidence to support this, so I recommend HPV vaccination after precancer or even after cervical cancer. Certainly, we aim to detect cervical cancer as early as possible. Early-stage cervical cancer has much improved overall survival and reduced recurrence. Even though you've been diagnosed with cervical cancer, family planning is still possible. When diagnosed at early stages, we have fertility-sparing treatment options that allow a woman to be treated for cervical cancer in some cases and continue to have fertility. I highly recommend having a medical team that you're comfortable communicating with. It's always safe to ask questions, get second opinions, and remember, at the end of the day, we're all here to help you on the same team. Never hesitate to ask your medical team any questions or concerns you have. Being informed makes all the difference. Thanks for your time, and we wish you well.
That was great information. Are you ready for your next question?
Yep.
Here we go. I have psoriasis and had an outbreak on my penis. Is there anything I can do to help with pain during sex? Also, can you explain what genital psoriasis is and what causes it?
Genital psoriasis is psoriasis that affects the skin on or around the genitals. It results from an overactive immune system leading to patches of painful, smooth, or flaky, discolored, and itchy skin. Unlike psoriasis on other parts of the body, genital psoriasis patches are typically moist rather than dry and scaly due to the friction in the area.
Wow, so what would trigger it?
Well, it can be triggered by yeast overgrowth or skin injuries or from friction from sex or tight clothes. Avoiding these triggers can definitely help reduce the flare-ups.
I mean, tight clothes because what? Because of ventilation?
Yeah, well, and anything, if you're having any fungal infections, tight clothes are going to make that more likely to happen.
Trap the moisture in there? Is that what's going to happen?
Yeah. Okay. But the onset of psoriasis typically is something else. So most people actually have psoriasis after a strep infection. And it is a hereditary condition. Most people just have it on their knuckles and knees. I actually have it. Only on knuckles and knees.
We're going to close up on those
yeah,
knuckles, please.
I have it. It's fine. It's normal. I used to be embarrassed, but now I'm over it. And neither of my parents have it. So I always blame them. And they always say, like, well, neither of us have it. And I'm like, it's hereditary. Like, by definition, it's one of you guys' fault.
There you go. You can blame them. Blame your parents.
Exactly.
Tell me about the treatments.
Well, typical treatments involve topical creams. For example, there are numerous corticosteroid creams, coal tar creams, or retinols. For more severe cases, there are also oral medications and injections.
Can flare-ups be prevented?
While you can't prevent psoriasis entirely, you can help reduce flare-ups. Definitely avoid triggers. Make sure you're moisturizing, using mild and fragrance-free soaps, or using soft toilet paper and not wearing any tight clothes or underwear.
So let's calm some minds out there. Is it safe to have sex with a flare-up when you have a flare-up?
Well, yes, you can still have sex with genital psoriasis. You may want to consider communicating with your partner to alleviate any concerns and let them know that it's not contagious. It could be more comfortable if you use lubrication during sex. And you'll want to make sure to keep that area clean, especially after sex. As always, connect with your doctor to make sure you have a good treatment plan that is tailored to your needs.
Let me see that knuckle again. So that's a
I'll
flare-up.
fist bump you with my psoriasis knuckle.
There you go. Let's take our next question, Dr. Leah. I don't feel pleasure when I orgasm. What is wrong? I've always been like this.
Well, there is something called sexual anhedonia, which is a condition where individuals do not experience pleasure from an orgasm. While they can sense the physical aspects of the climax, the intense feelings of pleasure that usually accompany it simply aren't there.
You know, wow, I can't imagine an orgasm without the pleasure. So it's almost, I mean, just for reproduction perhaps, but that's about it.
Yeah, listen, I'm with you.
Yeah, okay. So to avoid it, what causes this?
Well, sexual anhedonia is a hypoactive sexual desire disorder. Typically during orgasm, the brain releases chemicals that trigger muscle contractions and feelings of intense pleasure. For individuals with sexual anhedonia, while the effects of orgasm are present, the pleasure sensations are missing. This can affect men or women.
Dr. Lee, I mean, this is fascinating. I would never think that you could have an orgasm and not have pleasure. What are other factors that could...
Well, there are several other factors that are thought to cause sexual anhedonia. It might be caused by neurochemical imbalances where there's a dysfunction in the dopamine release or response. There are also certain medications that inhibit dopamine. Hormone imbalances like low testosterone or high prolactin might also cause it. And then there are factors like age, physical conditions, and possible vitamin toxicity like too much vitamin B6.
So Dr. Lee, how would the viewer know that this is what they have?
You want to get a formal diagnosis, and the diagnosis can be comprehensive to rule out any physical, psychological, and pharmacological causes. Blood tests to check hormone levels and reviews of medication history are also really important for the diagnosis.
And do you know any treatments for this?
Well, it really might be a combination of psychological treatments and medication. Psychological therapies include sex therapy and counseling, which can address past traumas and anything restricting pleasure. Medical treatments might involve switching current medication or using medicines that enhance dopamine. Hormone therapy could also be used if there was an imbalance. And there are even more options that a doctor could prescribe. Someone experiencing this condition would also want to look into their diet and exercise routine as well as managing stress. Improving all of these can also be good for your overall sexual health.
Doctor, you mentioned the medicines that enhance dopamine. Is there anything else, the natural, that might enhance?
Have sex. That helps dopamine. If you want to increase your dopamine levels, you want to increase, your desire for sex, start having sex.
Okay.
There's a bunch of things that can increase dopamine. Anything that's really making you feel good, from the healthy way like exercise to the unhealthy way like alcohol and drugs. All that's increasing dopamine.
And don't forget about chocolate.
And chocolate.
World famous chocolate.
Yep.
You ready for our last question?
Yep.
Okay, here we go. I've been using sertraline and experiencing delayed ejaculation. Is this normal?
That is a common side effect, and it's even used to prevent premature ejaculation. Ejaculation is a complex process that involves several chemical messengers in the brain, one of these being serotonin, a neurotransmitter that helps regulate mood and other bodily functions. Research has shown that serotonin levels influence the timing of ejaculation. Lower levels can lead to faster ejaculation, while higher levels can delay it. Sertraline, or commonly sold under the name Zoloft, is an SSRI which increases serotonin levels in the brain.
That's fascinating, Dr. Leah. Can you tell us more about using it for premature ejaculation?
Well, there are a lot of studies that have looked into people using it this way, and many of them have found significant improvements in ejaculation time and overall sexual satisfaction for these participants. For premature ejaculation, sertraline typically shows noticeable improvements after about 4 weeks, which is similar to the time frame and its effectiveness in treating other conditions.
But for some, this is just a side effect, correct?
Well, some of the sexual side effects include lower sex drive, ED, and delayed ejaculation. It's estimated that up to 80% of people taking SSRIs may experience some form of sexual side effect. If you're experiencing sexual problems while taking sertraline, it's important to talk to your healthcare provider. Do not stop taking the medication without talking to your doctor, because this can lead to antidepressant discontinuation syndrome. Symptoms of this syndrome can include flu-like symptoms, dizziness, tremors, and mood changes. Your doctor may recommend gradually lowering your dose to minimize withdrawal symptoms.
Thank you, Dr. Leah. Great answer.
Well, Derek, really enjoyed today's show. I loved answering these questions, but we're all out of time. So we'll see you next time on our Sex Talk program, where we answer the questions you've always wanted to ask.